So I was the professor of hematology, both the clinical service as well as the laboratory service. This was the only setup in the country where one head ran all the clinical and the laboratory, the diagnostic service. So the diagnostic service now is under the NHS, National Health Laboratory Service, and the clinical service obviously continues being a provincial type of activity. I was also the director of the leukemia unit. It's a research unit, it's a UCT accredited unit, as well as the director of the bone marrow transplantation program. And I hope that I am able to bring some of that stuff here to Rondebosch Medical Centre. So I think that it is one of the probably state-of-the-art units in the country, probably the most modern of the units. It's a biggish unit, 10 beds. I think it's the largest in the Western Cape, second largest in the country. So it was built basically with the latest specifications, looking, scanning the future and trying to see what's going to happen, where we're going with technology. So I think that this is a unit that will serve us for many years. And it would be nice to perhaps try to expose this unit to not only just to South African patients, but patients around Africa, because I think that it is one of the most probably modern units in the world. So this is a unit with a positive pressure. That means that the air outside the unit cannot enter into the unit. So it has pumps that generate positive pressure that goes through filters, very, very tiny filters, in order to make sure that the air doesn't have any microbes. So therefore, that unit, after a couple of hours, is sterile, not only because of the HEPA filtration, but also because each room has got what's called the laminar flow, which is a panel above the bed that leads to positive pressure being pumped, sort of sweeping the whole unit and the bed and so on, and with that cleaning up from any organisms that there may be in the room. So as I say, after a few hours that room becomes sterile. So one big source of infection, which is from outside, is eliminated. Another source obviously is the patient itself, and our gastrointestinal tract often has bugs, and we try to clean it with antibiotics, with prophylactic antibiotics, but often that is still a problem. So that unit is a protected environment for patients who undergo very intense chemotherapy or bone marrow transplantation or stem cell transplantation. So very intense chemotherapy eliminates the production of white cells in the body. So basically patients become very immunosuppressed. So therefore any bugs can be life-threatening to those patients. And that's why the need of having a protected environment, number one. And it's not only just the protected environment, it's the training of the staff that are able to handle everything in a sterile way. And our staff has been trained over many years, coming from UCT hospital, and they are very, very professional in that. So the most common patient that needs these facilities are patients with acute leukemia. It's a condition that's seen in either younger children or older patients, but also other patients need what we call high-dose therapy or high-dose chemotherapy. For instance, for the rescue of patients with lymphomas and myelomas, we give them supralethal doses. That means doses that if you didn't give a transplant, actually the bone marrow will never recover and the patient will die. So they receive supralethal doses of chemotherapy that will kill the malignancy, but at the same time you need to bypass those toxic doses, and we then give an infusion of their own stem cells or somebody else's stem cells in order to, because the bone marrow not only makes the blood, that means red cells, white cells and platelets, it also manufactures and produces the immune system. So therefore you have basically got two organs in one. Skills in South Africa are still of a very high standard, and as I say, our nursing staff is highly skilled. At the same time, our results are no different. We've got publications over a period of 20-25 years showing results no different from some of the so-called first world countries like the US and Europe, as well as our costs are a fraction to their costs.